Nagbabalik po ang Good Morning Kapatid. Sa unang tingin, mukha namang harm-free ang mga nunal na makikita sa ating balat. Pero alam niyo po ba mga kapatid na kung minsan pala, posibleng palatandaan na pala ang nunal na isang uri ng skin cancer. Yan po ang pag-uusapan natin ngayon kasama ang ating resident morning doctor na si Doc Richard. Good morning, Doc!
Good morning, Mommy Dames, and good morning din sa ating mga kapatid. Ako, Mommy Dames, tama ka, matinding panganib talaga ang dulot ng melanoma. Lalong-lalo na kapag hindi ito agad na agapan. Kaya naman mga kapatid, para ibahagi ang mga mahalagang impormasyon tungkol sa melanoma, kasama natin ngayon ang isang oncologist mula sa Philippine Society of Medical Oncology, Dr. Arthur Go. Good morning, Doc.
Good morning, Doc. Welcome to the show and thank you for being here. I know we're very, very early, pero I hope you know na dito sa ating BalikAlindog na segment, marami tayong natutulungan ng mga kapatid magkaroon ng awareness, lalong-lalo na ito ay napaka-importante.
Yes, totoo yan, Mommy Dames. Pero umpisahan na kitang tanungin, Doc, ha? Para sa ating mga kapatid na hindi nakakaalam, ano nga ba ang melanoma, Doc?
So, melanoma is a cancer that nagagaling siya sa melanin, so the pigments of our skin. So, dun siya, nagmutate siya, and then it grows deeper to the skin. It actually can spread to the other parts of the body through the lymphatics natin, no? So, we have other skin cancers, no? We have the non-melanomas, you have the basal and the squamous, and may mga Merkel cell na mas aggressive pa. But among the three types of the skin cancers that the common are is the melanoma is mas aggressive talaga.
Okay, Doc, ano nga ba yung mga pangunahing sanhi o yung mga risk factors ng melanoma?
Okay. So when it comes to risk factors, of course, age is one of that. No, if the patient is more than 50 years old, that's one. And then male is more mas prone ng male kasi sa female.
Lalaki?
Yeah,
Okay.
sa lalakihan. And then of course, meron tinatawag natin there's a Fitzpatrick chart scale na it's from 1 to 6. Yung 1 is more the lighter skinned, mga red hair, mga blue eyes people. And then you have the darker skin. The ones who are in the lighter part of the skin, the mga Fitzpatrick 1, they are much more prone, no, to have those cancers, the risk for the melanoma and then other skin cancers. And of course, you have the genetic diseases then that can actually lead to cancer. Meron pang iba yung mga, for example, nag-radiation before. So, of course, meron kasi may mga pasyenteng mga lymphomas o kaya mga breast cancer in the young na nag-radiation sa skin. So, of course,
yung mga chemo, ganyan ba, Doc?
No,
Iba yun?
radiation itself.
Radiation.
Kasi pag miso yung mga younger patients na nagkakaroon ng radiation for the breast.
Right. Okay.
Yeah, so yung radiation itself can actually cause inflammations, can mutate the skin.
Over time?
Yes.
Okay.
And then you have also other, like problems, like for example, you have may mga bumagsak yung immune system nila because of transplants, bone marrow transplant, liver transplant, kidney transplant. They can actually cause, because bumaba immune system nila, nag-change yung kanilang biology, it can actually cause skin cancer as well.
Wow.
Yeah.
Sobrang dami pala ng risk factors talaga ng melanoma, no? Pero since nasabi mo na yung mga risk factors, Doc, ano naman yung mga sintomas na kailangan natin tignan?
So, meron dyan tinatawag natin, very simple, no? In alphabet, it's A, B, C, D.
Okay.
E. No?
Okay.
A, B, C, D, E. So actually, may bago pa nga, may F pa nga sinasabi na
Nadagdagan na.
Nadagdagan pa siya actually. So yung A is asymmetry. When you say asymmetry, so ihambing nyo siya na parang, let's say for example, ito.
Oo.
Picturein nyo na dapat pantay siya. Pag hinati mo siya sa kalahati, dapat pantay siya. Hindi siya, dapat balanse. Yung
Ang
mole.
nunal, you
O yung
mean.
mole, yeah, oo. And then, for example, that's for the asymmetry, no?
Paano naman, Doc? Sorry, let me just cut you, Doc. Kasi yung sa asawa ko, marami siyang mga nunal. Parang, kumbaga, inborn pati yung mother-in-law ko. May ganun, may lumalabas bigla, ganyan. Paano mo naman malalaman? Or meron bang extra sintomas to find out kung kailangan mo i-check yung symmetry?
Yeah. So no. It's just to see if the same. Kasi that's why you have to complete yung A, B, C, D, E.
Yeah, all.
Yes,
Okay,
check mo yun.
sige.
So, and then the borders, no?
Borders nung nunal.
Yes. So that's
border.
why some of the, usually mga ganito kasi dermatologists have their dermatoscope. So when you say dermatoscope, it's really, they look at it, they will actually see it parang mas clear talaga. No? And see the borders, no? Yung borders, yung paligid ng nunal, kung may mga irregularities ba, may mga rugged edges, yun. So yun isa sa mga one of the factors as well. And then you have the C, the color. So remember, melanoma is a cancer from the melanin, from the pigments, meaning dark siya dapat. So pag nakita mo nag-iiba change, nagkakaroon ng black, may brown, may red, So nagkakaroon change in color, yun. So it's one of the risk factors, nag-iiba yung color nung mole. And then you have, of course, yung diameter, the D, no? A, B, C, D, E. So yung D niya is diameter. If you see a pencil, yung pencil na, yung eraser, so bigger than that, it's parang may potential siya, no? Bantayan siya. It's more of 6 millimeters.
Opo.
Or 1/4 of an inch na diameter. Pag lumaki pa doon, medyo bantayan.
Yes.
And then, that's the D. And then you have the E. E is evolution. Nagbabago yung anyo nung mole, no? Na from flat, minsan nagiging raised, no? Nag-iiba yung edges. Then, F is yung mga funny shapes. So, meaning, for example, may 10 siyang mole na usual na niya. And then, merong kakaiba doon na yung add ang itsura among all those mole na iba. So, yun yung babantayan.
Okay.
So, yun yung nadagdag to.
Iba yung itsura niya.
Oo, iba yung
Dati
itsura
kasi
niya.
hanggang ilang yan, Mami Dims. So, nadagdagan na pala siya hanggang F na ngayon.
I think that's the beauty rin of, medicine technology is that every now and then talaga nag-a-adapt. I guess, base din yan kasi sa mga dumarating na mga pasyente sa inyo.
Yeah,
correct?
yeah,
Diba?
yeah.
Na parang, meron palang ganito, this is another tell. And ako talaga, I'm always so amazed. In fact, nung bata ako, pangarap ko yan, maging doktor. Takot lang ako sa dugo eh. Pero ito kasi, Doc, just going back to what we were talking about, kasi nga, I was telling you that my husband actually has a lot of moles. So isipin mo, ang dami kong babantayan. Pero ano nga ba yung tell or easy tell na ang isang nunal ay maaaring kailangan pabantayan mo sa dermatologist or sa doktor or eksperto kung ito ay maaaring tumawid to melanoma?
Okay. So yun din. So you have to consult a dermatologist talaga. Sila talaga yung expert when it comes to
Is it painful?
the melanoma.
Well, may sakit ba?
Well, meron kasi nagkakaroon ng bleeding. May chance mag-bleeding siya. No? May chance
alright.
mag-bleed din siya. And then, of course, if it's not healing, no? So that's one of the concerns din dyan. Now, it goes deeper to the skin. So, kasi yun siya from the superficial part, sa ibabaw, din bababa siya to the dermis, to the yun, medyo nagkakaroon siya sometimes ng mga discomfort na. But usually talaga, when we have those evolution na over time, then we advise, no? The dermatologist will advise you to do biopsy na, no? Punch biopsy, skin biopsy, just to check na talaga if it's really a cancer or not.
Right.
Pero Doc, ano naman yung mga pangunahing treatment options natin para sa melanoma?
So when it comes to treatment naman kasi, depende sa stage yun. No? The earlier the stage, usually it's surgery talaga. We call it, the dermatologist will call it Mohs surgery, micrographic surgery. So it's very, especially yung ginagawa yan sa mga, pag yung mole, yung melanoma, it's in near the sensitive areas, the face, no, yung mga eyes, yung mga areas.
Malapit kasi.
By the way, melanoma can be also seen in your mucosa, so mga sa loob ng organs natin, nakikita rin siya in between the palms, in the sole.
So hindi siya parang yung normal sa mukha lang, back, body, no? Pwede rin pala everywhere.
Actually nga yung in the US nga, 'di ba? Like for example, Khloe Kardashian had parang melanoma. It's a different type. It's not the color of nakikita mong pigmentation. It's like a pimple lang, but the color was actually para siyang pinkish lang, but it was a melanoma. So it's really, sometimes it changes na talaga, no? So you have uveal, yung sa mata, nagkakaroon sila, pwede rin magkaroon melanoma yon. So what do we do is that, of course, as much as possible, we want to preserve the cosmetic part of the body. No? So we do the Mohs surgery. Actually, not me, the dermatologist or the surgeon will do that just to make sure lang naman na when they do the biopsy, when you remove the tumor, gusto nila kasi clear margin, maganda yung margin. At the same time, to preserve din syempre yung ma-preserve sana yung facial features ng pasyente as much as possible. That's the early part. But of course, when it goes deeper, no? So we do scans na, we do CT scans just to see if may kumalat sa kulani. So if that's the problem na, now dun papasok yung mga systemic treatments. Now we do tests, especially for advanced cases. Nowadays, we do genetic molecular testing. It's called BRAF mutation. So that mutation, it's usually 50% of melanoma has that mutation. And if you have that, through your molecular testing, there is treatment to stop that BRAF mutation because yung mutation na yun nakikita mo sa genes nung abnormal cell na yun, you can stop that. That's the driver mutation. So meaning, kumbaga yung mutation na yun, siya yung talaga nagdadrive para dumami yung cancer. So what do? You stop it. by giving that medication. And then, if not, if mag-progress, you can actually give immunotherapy na.
That's right. Oh, grabe. Ako, I'm so amazed kasi when you think about it, often these are things na hindi mo masyadong pinapansin sa katawan mo. Pero napaka-importante po talaga, kaya dito sa BalikAlindog, na lagi natin pinaalalahanan, itong mga tells na ito, tandaan nyo po mga kapatid, lalong-lalo na galing pa sa ating mga eksperto, mga doktor, no? Dahil ito ay mga bagay na kailangan, pinaka-the best talaga dito yung naaagapan mo habang maaga pa lang. Hindi ba, Doc? Naku.
Agree.
Doc, maraming salamat. And I'm sure marami sa mga kapatid po natin ang nag-enjoy sa inyo. Doc, anywhere we can see you, follow you. You can also promote your social media accounts if there are any.
But first of all, just want to say, how do you avoid?
Ayun, sige, Doc.
You have to avoid. Of course, avoid sunlight like more from 10 to 4 o'clock. That's one.
10 a.m. to 4 p.m.
Yun talaga yung
Malakas
pinaka,
yung
yes.
kanya.
And then of course, sunscreen, at least 30 SPF. Yun talaga, no? Just do the sunscreen.
In all of the body, Doc, na exposed.
Yeah. Even here, if you have this lights, talaga dapat you really put
Naku, hindi pa man din ako naglalagay.
So you
Kasi
have
kampante ako.
kasi these lights pa rin can have UV lights pa rin naman, especially UVB, no? Especially the sunlight. So yun, please do that talaga. Yun ang pinaka-important. Especially this summer na tayo.
Yes.
Yeah.
Extra init pa man din ngayon, Doc,
Yes,
no?
yes.
Doc, maraming salamat. At mamaya magkakonsulta ako dito kay Doc Richard kung anong SPF ang magandang gamitin. Doc Richard, Doc, maraming salamat. And I
Thank you for
hope that
having
you
me.
come back anytime, okay?
Yeah.
Anytime. Thank you
Sure.
for waking up very early for us.
problem.
Mga kapatid, Dimples Romana po, kumpletuhin ang inyong umaga ng mga kwentong puno ng inspirasyon. Salubungin po ang bawat araw ng may ngiti at pag-asa. Kaya't mag-subscribe na po at mag-follow na sa aming social media pages ng News 5.